Wow! Hey Dada, look at the flowers over there. Let's go there. Mom, look at Tai. She looks gorgeous.
Hurry up, start copying this matter.
It is foggy all around, the world drowned in darkness. Eyesight is lost forever. It is the end of smiles. According to the World Health Organization, 285 million people have impaired vision. India has the largest number of them. Out of 39 million totally blind, 15 million are in India. This huge number sounds a warning bell.
येता रविवारे धुळाले शारदा नेत्रालय झाले डोळा बिंदूची चौकाची करणावई जावाना टाईमले रामला जय जालना कडून सही तपासणी पत्ता लिहिल्या
Every year, about 4,000 rural people attend this mega eye camp. These rural people can't afford huge medical bills for ophthalmic treatment in big cities. Sharda Netralay at their doorstep is a God-given gift. On account of correct diagnosis and dedicated service, the number of patients at the camp has exceeded 4,000 from a modest figure of 150 in 1994. After registration, the new patients are provided the initial eye checkup. The checkup is the first step for preliminary diagnosis. Then follows an in-depth examination using modern equipment to determine the urgency of the operation. Those not requiring emergency service are given future appointments, instruction for eye care in the intervening period, as well as a supply of appropriate medicines. For those patients in need of emergency service, a detailed cornea checkup is provided along with a prescription for eyeglasses. In the process, a file is created with a record of all examinations and relevant prescriptions. To determine the possibility of other illnesses, the patient is sent for blood and urine tests. Following these tests, the patient is given a thorough medical checkup for blood pressure, diabetes, and other similar conditions. Then the patient undergoes another eye checkup to determine the right kind of lens to be inserted. The patient is now admitted for cataract surgery. The cataract is removed by means of laser surgery, and a new lens is inserted in the eye. The next day, the patient is sent home with advice about proper care and precautions. The patient is given a follow-up examination after 7 days and is provided with a prescription for eyeglasses. The patient is called back for a final checkup after 45 days. A team of highly skilled physicians and ophthalmologists provides expert services at Sharda Netralay using state-of-the-art facilities. Along with modern facilities and excellent treatment, Sharda Netralay provides counseling to the patients and conducts eye care awareness programs in rural areas. Sharda Netralay has a well-equipped mobile van which visits rural areas that do not have medical clinics.
Our optometrists provide free eye checkup for the less fortunate who cannot afford to travel to the city and pay for doctor's fees. For a nominal charge of 20 rupees, our optometrist finds numbers for their eyeglasses.
Sharda Netralay has brought a ray of hope to rural people urgently needing vision treatment. Sahud was only 6 months old when his mother accidentally discovered that he had a cataract in his eye.
As he started crawling, his eyesight started diminishing. We took him to Sharda Hospital. They examined his eye and told us that if we operate within 15 days, he will be okay. Otherwise, he will lose his sight.
Surgery of a 6-month-old is a scary thought for parents. Besides, there is the worry of procuring money for the surgery. Sharda Netralay assured them that financing was not an issue. The family agreed for the required surgery.
Our child got back his sight. His future is bright.
Today, Sahud is not a burden for anyone. He can hope for a better future. Innocence does not prevent an accident. While playing with friends, a sand particle flew into Sonu's eye. Blood coagulation led to cataract formation.
I am a hawker selling bread and omelette to feed my entire family. The life is tough.
Pundalik Chavan had no job matching his education. Sonu's eye injury added to his worry.
How would I find a match for Sonu? Would she remain unmarried for all her life because of her vision deficiency? This question was haunting me day and night.
He read about Sharda Netralay and a ray of hope flashed through his mind.
I prepared an application explaining the problem of Sonu and my economic condition. The very next day, your representative came to my house and told me that the doctor is going to operate on Sonu.
The operation was successfully performed as scheduled. Pundalik had nothing to worry about. Once hampered due to poor vision, Sonu started enjoying her playful childhood. Carelessness often causes an accident. Akshay's case is an example. While playing, he accidentally poked his eye with a stick. Blood coagulated, resulting in a cataract.
It was night time. We could not take him to any doctor. Next morning, we took him to the government hospital. They could not do anything. They advised us to go to a private clinic. We went to a private clinic. They told us we have to go to an eye hospital. Someone had read about Sharda Netralay. He advised us to go there.
Akshay's father drives a tractor. Living hand to mouth, he could never save for a rainy day.
Where could I get the money for treatment? I borrowed from my employer against future salary for general expenses, but it did not cost a penny at Sharda Netralay.
Because of timely treatment, Akshay has bounced back into life with confidence. Who knows, one day he may even win a gold medal. A bike went over a small chip of rock. The chip flew in the air and hit Arjun in one eye, creating a hole in the eye. A daily wage earner, Arjun borrowed money to get operated in Aurangabad. But the operation failed. It was a waste of money. A friend advised the heartbroken Arjun to go to Sharda Netralay.
We followed his advice and come here.
The doctor sent us for sonography. They told us that retina is damaged and surgery was necessary. They scheduled a date for surgery. They performed that surgery. Had I not come here, I would have lost my eyes.
Arjun and his father returned home satisfied and happy and resumed their work, earning a daily wage and feeding the family. Ramdas Pawar desires to do a lot for his family, but diabetes created a vision problem.
I'm suffering from diabetes for years and I was being treated in Nasik. While under treatment, all of a sudden my vision got affected. Everything seemed foggy. I received laser treatment 4 times from an eye doctor in Nasik, but there was no improvement. By then, I had spent lots of money and was deep in debt. Then I came to Sharda Netralay for eye treatment. But after the treatment at Sharda Netralay, I am functioning normally and can attend to my daily routine.
Once drowned in stark darkness, Ramdas now has strong willpower. He is not worried about his children's future. cataracts are the main reason for blindness in rural areas. The government is working on a national level to address the issue. Sharda Netralay is fulfilling its share. The achievements of Sharda Netralay are very impressive. Nearly 70 persons from India and abroad enthusiastically volunteer at the Sharda Netralay eye camps. Their experiences are overwhelming. Children are the future of the nation. Sharda Netralay has undertaken an ambitious project for eradicating vision deficiencies of children in Dhule district. We will train teachers to detect vision deficiencies so that the students will get immediate treatment.
We established Sharda Netralay to serve the less fortunate without having them to travel far distances to receive eye treatment. We feel happy that we have been able to serve these needy people over last 10 years.
The smile is back on my face. I have started a new life, tearing the curtain of darkness. I am riding on a ray of light. I have started a new life.